In this podcast series, we'll dive into the world of SDOH data, exploring what it is, why it matters, how it impacts the healthcare economics, and the obstacles and opportunities associated with it. We'll also discuss how healthcare organizations can leverage health IT and other tools to unlock the power of SDOH data and discover utilization patterns to better understand populations. If you're looking to navigate the value-based care world more smoothly and unlock the power of SDOH data, you've come to the right place. Let's get started. Episode 2, Operationalize your SDOH program for best outcomes, both clinical and financial.
Welcome, Dr. Decker. Thank you so much for joining us today. Today, we'll be talking about how to operationalize SDOH programs to optimize our both clinical and financial outcomes. My first question to you is, what are your insights on maximizing patient engagement so we can effectively capture SDOH data?
I think in our quest to be more efficient with workflows and see patients, one of the things that's happened is that we've lost the emphasis on building those relationships and connecting, with people as humans. And so I think that there are opportunities for us to look for other ways in which we might make things more expedient, but not when it comes to developing a relationship with the patient. And so I've always been a believer in taking time to really get to know that patient and to have a good conversation. And that might mean, rather than giving the form, asking them where they're at, in their lives, what they're experiencing, actually having conversations with that patient. And I think that there's opportunities to involve your extenders in the office to really, that if they're trained in that type of interviewing, that they could get at that information, or even the physician, right? Having an opportunity to spend time there. I think, like I said, building those relationships are really important. The other thing that I would mention, around people, there's lots of science about how you best engage people. And one of the things that I always think of, just to simplify it, there's lots of different things that we could think about, lots of different theories that we could, bring to the discussion. But I would say, think about people need to see themselves as users, and they need to see it as being useful. And so when we think about people being users, they need to feel safe, right? They need to feel that they're heard. And so again, establishing those connections with your patients are important. And then useful. Is there anything that's going to come of that when they, and like I said, and I just know that a lot of times we hand them forms to fill out, but if they pour their life out on the form, is anyone going to take a look at it? Is anything going to come from it? Really thinking about, how that information is going to be used. And that's not to say that every patient, right, is going to need help in some way. And I know that there's probably some folks out there that are saying, hey, wait a minute, that takes it outside of the scope of medicine. And I do recognize, that point as being very valid. But I think until we can take care of the whole patient, we're not going to really have an impact on their physical health. And it doesn't mean, though, that the physician's office needs to do everything. I think that there's opportunities, right, as we were talking about in our first session, to refer out to appropriate community-based organizations. But that's what I would say. Yeah, users and useful.
Absolutely. I would like to add just one thing to that I read this survey in which about 70% of patients preferred generative AI-generated text to ask them how they're doing about their condition rather than the text coming from the providers. So they thought those texts which came from generative AI are more humane, have more empathy, and that's a little bit concerning Do you think we are training our providers well on these factors? If I look back when I was either learning or teaching in the med school, we were so much into the basic medicine and not really into these soft skills. Neither were we taught about billing and insurance. Maybe the
Yes.
things have changed, but I would love your opinion.
I think that that's still the case, at least from the physicians that I work with. That's what I'm hearing. And, I obviously am more on the operational side of things, but definitely, definitely hearing that. And I think that it's not that the text messaging and things like that could not be useful. They very much can be, but it's really, again, in how it's positioned. And again, in that whole user and useful, those two pieces, it comes from something called the technology adoption model. So it definitely is specific. It has wide-reaching application, even though it was designed to look at technology and technology engagement. But again, I think that it's not that you can't use technology, you can still build relationships and have that feel. It's really, though, of, again, looking at workflow and where you can potentially, like, where are you best spending your time as opposed to not. And so if you're going through records to find information about a patient, maybe that's not the best use of your time. But if you can use things like AI or other systems, right, to be able to bring the story forward and be able to have those conversations. I'll just add to, since you brought up survey, working with several provider groups, I can think of two in particular where we had administered what was called a mock CAP survey. So this is where we look at how patients are engaged and feel that they're getting appropriate care from their physicians and from their health plans. And two of the questions that were always a challenge were always that whether or not the physician knew who the patient was before they entered the room, and whether or not they were heard. And I think that that's really important, in the conversation that we're having. I'm not a naysayer to AI. I think that we ask our physicians to do a lot. And so how can we use technology to support them? But just, again, making sure to give a nod that, that we're building relationships, and how can we use technology to help us with that, but again, still have that, that human connection. And then getting back to the point, that I said about that survey data, those were the two areas where I always found that were of challenge, was that my physician knew me, right? That we had a relationship, and I felt like when they entered the room, they knew what I was there to talk about, and they knew my health history. And then, just about, supporting them.
Thank you, Dr. Decker. That makes a lot of sense. I think it's important for the patients to know who they're talking to, and for them to share some of these things that they may not share otherwise. So they need to have a certain comfort level with their provider. What strategies should we be using as a health system, as a nation, to overcome some of these obstacles so that we can capture this data and really improve patient care?
Well, I think, I think that there is a lot of opportunity to use data that's out there. So not only the data that we get from our patients, right, when they're in the office and screening patients and having our office staff screen patients and having those conversations that I mentioned, but also too, what other data is available out there. And that's the great thing, right, about our world today, is that there seems to be an infinite supply of data. But I think the bigger challenge now is not where is the data, but how do we get that data and bring it together to tell that story. And so, there's Persivia, for instance, I know has a platform that helps doctors bring in data and standardize data. That's one of the biggest challenges, is you have all this data, but you really need to make sure that it comes in a way that's appropriate, that makes sense. And so again, that it can be consumed, meaning taken in and made sense of. And so having tools and intelligence like Persivia to be able to standardize data, to bring in that data, to put it together in a way that tells a story that's worth listening to, right? And that is informative, that can help the patient, get the care that they need. And so you have the ability, just by looking, we know the example that I used about patients calling in on the afternoon on a Friday, they're calling in looking for an appointment. There's a high preponderance, right, that they're going to end up in the emergency room that weekend a lot of times if they're not addressed. And so having those types of insights, being able to identify, where there might be challenges, say with health literacy or, food insecurity, being able to identify those patients and use that information to not only understand that story, but be able to take that story and connect them, right, to later chapters, if you will, or the larger novel of getting them the supports that they need, connecting them with the CBOs, those community-based organizations that can really help them. Because if you have someone, say that's, released to the home from the hospital and they're going into a situation that isn't necessarily safe, or, they don't have the appropriate food and nutrition to get better, or they don't have the health literacy to understand the medications that they need to take, right? These are all ways in which we can take that data, standardize it, like I said, tell that story, and then help them have a better ending, if you will, because we're providing them the additional supports that they need to get healthy and to have those positive patient outcomes.
Great, thank you. That makes a lot of sense. And thank you for appreciating Persivia. This was actually made as a collaborative CareSpace where everyone who has a stake in the well-being of the patient can come in and take care of that patient, and is not limited just to the provider like the EMR. So you can look at the entire population, different levels of cohorts, and then all the folks who are giving and providing that care, whether they are social workers, behavioral health, psychologists, obviously the care providers, care managers, physical therapists, pharmacists, all are welcome. They all have this space, and in the center is the patient. So I think the whole nation is moving towards that concept. So I'm happy to see that shift in our healthcare. Thank you so much for being a part of this episode with us. Have a wonderful day.
Thank you.